This usually plays out one of two different ways. Either one, you have done all the things. I mean, you've had all the testing, you've had things put in places where you didn't know they could go, you've taken all the supplements, everything has come back normal. And this has been going on for months and months. And finally, someone suggests maybe we should test your husband just to find out that he has low sperm count and quality. Or actually, they did test your husband at the same time that you were getting worked up, but they told you everything is normal. He's great. Just to find out they didn't look at some of the most important parameters that can contribute to unexplained infertility or even miscarriage. We are going to break down all the things for the man today. So this might be an episode that you want to share with your man. That's fine. That's exactly what this is for. Or even better, plan a little date night and listen to it together. I'm sure that's going to thrill him for sure. When it comes to male fertility, it's actually, surprise, surprise, it takes two to tango, up to 50% of the equation when it comes to unexplained infertility or recurrent miscarriage. And so often it's just so overlooked. And there's reasons why, we can speculate why that is. I think one, because the woman is the one who carries the baby. So we really just lean all into what is going on in the woman. The woman is oftentimes the one a lot more stressed and concerned about it. So she's the one reaching out. I once had a husband and wife on a call together and they were considering working with me. And the husband was like, yeah, we really haven't been trying. And she looked at him and I looked at him and I was like, so tell me, have you been having unprotected sex? And he was like, yeah. And I was like, okay, about how long have you been having unprotected sex? And he's like, for a year. And I'm like, okay, then you've been trying for a year. So sometimes they just don't get it, right? And we need to help them understand. So this episode is going to help empower you and your spouse with the information that you need to help dig deeper into your fertility journey and get some more clarity and some more answers. We're also going to cover how this one thing that's being offered and passed out like candy to men is actually male birth control. So let's go. God designed your body for fertility, but when the journey to parenthood feels like a heartbreaking mystery, it's so easy to feel lost. I'm Dr. Trisha, a nurse practitioner and fertility consultant who's been where you are. That's why I created Fertility by Design, where faith meets science to empower you with real solutions, holistic healing, and biblical encouragement. You are not alone. Your fertility is not broken. So let's walk this journey together. First and foremost, I want you to hear that men, you are not just a part of this journey, a very small part. I know we oftentimes will underplay your part, but you are a partner in the fertility journey and the outcome. Your sperm health really matters for the health of the baby, for the health of the placenta, for the health of mom during the pregnancy. All of these things are very important. You are a part of the outcome and you also deserve clarity and not guesswork. So when we're looking at the semen analysis, normal versus optimal, normal, is based on the average health of the population. A lot of our labs are like that too. And that's why there's such a wide range. And to be honest with you, what is considered normal now for a semen analysis years and years ago would have actually been considered infertile. So let's break that down. We're looking at volume. We're looking at count. We're looking at concentration, motility, and morphology. Okay. And we want to look at certain parameters of these and really break them down into normal versus optimal so that you can see the difference. So for instance, volume is how much semen is in the cup. Okay. So optimal there is greater than 3 milliliters. If we're looking at the concentration, that's how many sperm there are per milliliter. Optimal is really greater than 75 million per ml, but our standard semen analysis will say closer to 40 million. So that's an important differentiation. Here's where we really start to break things down. Motility. Motility is talking about how many are swimming. How are they moving? Are they moving or are they not moving? Okay. We want them to be moving, but we want them to be progressively moving, which means they are moving forward, and not just like spinning in circles or, like the typical male, not asking for direction. So they're lost and going in circles. Sorry, I had to say it. So when we look at motility, optimal would be greater than 61% and greater than 55% progressive if your semen analysis breaks it down by that. That's very helpful if it does. But again, you will see on a typical semen analysis, that number for motility is much lower. When it comes to total motile count, then that's going to give you an actual number versus a percentage. When we look at morphology, morphology is important and really indicates what the sperm quality looks like. So when we talk about quality, we're talking about what does that sperm look like? A head and a tail. That's what it's supposed to have. When we look at that on normal semen analyses, it says that anything greater than 4% is normal. Okay. That's saying that 4% of the sperm actually have a head and a tail. Otherwise, they have maybe like 2 heads and they have like 2 tails or whatever. They're abnormally shaped, but then they can't progressively move the way that they're supposed to if they're abnormally shaped. Plus, it really gives us a little bit of an insight of potentially the quality and presence of DNA fragmentation that isn't going to result in a healthy baby from those sperm. Optimal for morphology would be actually greater than 15%. So there's so much room for improvement. Now, why do fertility clinics not typically tell you this? I think it's multifold. One, research is still developing on the pieces of how important this is, especially things like morphology, because historically, what do if we are moving towards IVF or IUI? They are using the microscope to pick out the absolute best ones, and those are the ones that they're using for IUI. Those are the ones they're using for IVF. So if you're continuing to try naturally, they don't care about those things because that's not their track of mind. So if you are moving on to more assisted approaches like IUI or IVF, then those things, those parameters don't matter as much to be in the optimal range because they're going to pick the best ones. But what about when those things do not settle with you and those don't feel like where you're supposed to go next? You're getting dismissed and you're not being told any other way these things can be improved and get closer to the optimal range so that pregnancy is more likely to occur naturally the way God designed it. What can we do to take some of these normal values into the optimal range, and why would they maybe be low? First, I think it's important to look at risk factors that could be contributing to low sperm quantity and quality. A little thing I mentioned before that I want to go back to just for a second is I talked about DNA fragmentation, but I didn't dig deeper into that. It's not on a lot of semen analysis. It is a very important piece if you can get that. That really helps us see, is there a lot of DNA fragmentation, which means there's probably a lot of inflammation in the body that's contributing and negatively affecting the sperm quality. So there is that. But what are things that can negatively affect the sperm quality and DNA fragmentation? Well, we know hot tubs, saunas, laptop on your lap, a lot of heat exposure, those things can negatively impact the sperm count and quality. Nutrient deficiencies, this may be coming from not eating enough protein. It could be not eating enough at all. It could be eating a lot of processed food that doesn't contain a lot of nutrient-dense ingredients. It could come from gut health issues where absorption is not actually happening. So that could be multifold. Smoking, alcohol, and drug use are 3 of the biggest, most studied things that are going to negatively impact fertility in men, especially marijuana is one that people overlook. Smoking and even things, what are they called? The Zens or whatever, and things like that. We want to be very mindful of those things because they're going to negatively impact sperm count and quality. Of course, environmental toxins, the same way they can affect the female, they can affect the male. They can be endocrine disruptors. They can mimic estrogens in the body, things like plastics, pesticides, heavy metals. One cause of very low sperm counts that needs to be ruled out right away in the beginning is a varicocele. So a varicocele can be an enlarged vein that blocks the sperm from releasing. And so the counts are very, very low in this case. So this is something that you always want to have ruled out if your levels are quite low across the board. Low testosterone can negatively impact sperm count and quality, as well as chronic stress and not getting enough sleep. Sleep is huge. Sleep really has a detrimental effect on testosterone, which then is going to negatively impact sperm. So if you're not getting good sleep, guys, that is really important. Don't overlook it for sure. So what can we do about it? Well, we can really dig deeper into a lot of these things. It's not just the semen analysis. Oh, it's not normal. Okay, here, take these supplements. Or, oh, you have to do IUI or IVF. There's options for men too, just like there are for women. There's supplements we can do. There's testing we can do. There's so many different things. So really, I think at this point, if you are, hey, my numbers are not in that optimal range, we've been trying to conceive for a little while and we are not getting pregnant, it makes sense to dig into both sides of the equation. So men, you need testing too. Looking at your total and free testosterone levels, your LH and FSH to see if the drive to create those hormones are there and our feedback loops are working correctly. Vitamin D, zinc, omega-3 levels, looking for inflammation or oxidative stress with something like the GI map, what's going on in the gut, looking at maybe some more micronutrient testing like a metabolomics. These are all things that we can dive deeper into and really get more clarity around the why. Why is it low? Especially if you're like a young, vibrant guy and you should be feeling your best, but you're not. We need to dig into that. It's not just about your semen analysis. It's also about how you feel. How are you going to be when you become a dad? You need that energy to run around with your kids. So if you're already not feeling 100%, or maybe you're tired, sluggish, you have these vague GI symptoms, same as women, you guys deserve to feel well. You deserve to have vibrant testosterone levels at your age. But why don't you? Versus what is actually happening in traditional medicine is really controversial in my opinion. And it's starting to get more attention and I'm so excited for it. Men are getting TRT, testosterone replacement therapy, passed out to them like candy. And here's the thing, I'm not against it. You deserve to feel great. And if that's what we need, then awesome, let's do it. Except for not before we figure out why you're 28 and your testosterone is in the tank. Why you're 32 and you feel like you can barely wake up in the morning and you're not gaining any gains in the gym. Why? So we really need to dig into the why the testosterone is low in the first place. Numerous reasons. One, because you deserve to know why, because TRT is expensive and it's not a long-term fix by any means. It also breaks those feedback loops I was talking about, and your endogenous testosterone that you create in your own body will actually be decreased because your body's relying on it from coming from the outside. And that, my friends, is going to negatively impact your sperm count and quality. Actually shuts off those feedback loops, and that endogenous testosterone feedback loop is not happening, and it really negatively affects sperm production and is essentially male birth control for many, many men. Many men aren't being told this before they start on it. So if they are planning to have a family and those discussions weren't had, I am now seeing so many men say, I didn't know this, or they just weren't told. I had a couple who came to me, he was feeling horrible. His testosterone levels were very low. They put him on testosterone replacement therapy, but they wanted to try to conceive. Once they kind of got going, realized it wasn't happening, he got a semen analysis, and lo and behold, his counts were so low, if not zero. That's obviously a problem when you're trying to conceive. But now we've shut off those feedback loops. His body's used to having that much testosterone, and when he comes off of it, he doesn't feel very well, and it takes time for those feedback loops to rewire. So what we did is we started digging into why. Well, nutrition was a mess. Not eating enough of the right things. Gut health was very compromised, lots of gut dysbiosis and gut lining breakdown, so not absorbing the nutrients that he was taking in. And he has sleep apnea. So that's a big issue when it comes to testosterone production. Now, will these things heal overnight? No. It takes time. So sometimes we need to do other things to support testosterone in the meantime. There's different herbs, there's different supplements we can do to target that, and we can dive into those in a little bit. But And just know it's not an overnight fix, so you might need a combination therapy. A lot of times in traditional medicine, they will use Clomid to help boost the testosterone level, and I don't see anything wrong with that at all. If a man is coming off TRT trying to conceive using Clomid. However, we still want to look for the why underneath. Why? Can we help get him off of this long-term testosterone therapy, or at least minimize the dose? As far as supplement recommendations, I'm only going to throw out some things here. I don't want you going to buy every single one of them. You need to know what exactly is going on in your body, because if I'm telling you to take a bunch of antioxidants, but your gut is still a wreck, well, we're really just like putting on another Band-Aid. So that's not really helpful, is it? So I urge you to get tested. A not so subtle plug to come work with us at TZ Fertility, because we love working with couples, and it's just such a passion of mine because it's so important. And when you walk this journey together, not only does it help you all get closer to your baby, but it also strengthens your marriage. So if you have questions about any additional testing, check out the show notes. There's a link to apply to work with us. We would love to chat more with you about that. As far as supplements go, really, the target would be on driving down inflammation, so using things like omega-3s for that, targeting oxidative stress with CoQ10, L-carnitine, N-acetylcysteine, optimizing other nutrients such as vitamin D, zinc, selenium. So a lot of supplements will really focus around those things. Again, if we've got a lot of gut issues, we need to revisit that. If it's a sleep or lifestyle issue, we need to address that. Back to that couple that I was telling you about. They used Clomid in the interim while changing so many nutrition and lifestyle factors for the both of them. She also had a lot of inflammation going on with zero answers from her fertility specialists. And when we did that, when we gave this holistic targeted approach for both of them, guess what happened? They got pregnant. They're actually due very soon. I'm so excited for them. But that's the power of really getting to the root of what is going on. So I know I threw a lot of information at you very, very quickly. If you are trying to conceive, do not wait until you've ruled everything out on her side. Do it together. Make sure that if you've been struggling to conceive for even 6 months of timed intercourse, it is now time for both of you to start getting a workup and really dig deeper into what's going on. Okay, men, I talked a lot about you, so let me switch gears to the ladies real quick. I have something really awesome and free for you. If you have been wondering about your labs and what in the world you should have had checked, what the numbers mean, and all the things, and no one's explained it to you, then you need to grab our Decode Your Fertility Labs free guide. This is going to help you understand your labs clearer, and there's a special offer in there just for you. I challenge you to share this with somebody else that needs to hear it, especially your spouse. If you are intrigued about further lab testing, book a review. If you're looking for a second opinion on your labs, I do fertility audits as well. And if you guys have any questions at all, please reach out, join our fertility Facebook group, ask your questions. I would love to have them answered. Thank you guys for being so patient with me as we move. As you can see, if you're watching this, this is my bedroom/office now. My husband is going to be building me a she shed, but we are all very busy. And so it's going to take some time. So for now, this will be it. This will be my podcast studio. Thank you for your patience in the past couple of weeks as we've taken a little bit of a break to kind of get our feet under us as we moved. I appreciate you guys. Again, if you have listened to this episode and you feel like it's blessed you, please share it. And we will hopefully be here, God willing, with you next week for another episode of Fertility by Design. That's it for today's episode of Fertility by Design. Subscribe so you never miss an episode. Leave a review to help more couples find hope, and share this with a friend who needs encouragement on their fertility journey. Need even more support? Let's connect. Find me on Instagram at Trisha Zehrung for faith-filled fertility guidance, real solutions, and a community that just understands. Remember, your fertility is not broken. Your body is beautifully and wonderfully designed, and God's plan is always perfect. I'll see you next time.